Babe,
Yeah.
hey, so I just saw on Facebook that if I do hormone replacement, I'm going to get cancer. Is this true? Tell me. Tell them,
Well,
Katie.
all the geniuses of Facebook and all their information, right? Um,
I'm a little offended.
the answer is not a straightforward yes or no. Mostly, no. There are some risks. Usually it's with how we do it. For instance, if a female takes estrogen and estrogen alone, if she has a uterus, that can cause cancer. But we don't treat with estrogen and estrogen alone. If you have a uterus, we always treat with estrogen and progesterone. We mitigate that risk.
Oh, yeah, that's
Okay.
right.
So that's
Okay.
number one. So that's the biggest misconception.
Okay.
Number two, a long time ago, like late 90s, early 2000s, there was this huge study, one of the largest studies done for women's health. It was called the Women's Health Initiative. And it was a really terrible study. It went bad. It didn't study the right people, didn't study the right drug, all that stuff. In fact, it was so bad, it was cut short. And then it somehow got published in Time magazine instead of an actual medical journal. Might have been People magazine. Don't quote me on that. But basically it said estrogen or hormones bad equals cancer. These doctors are trying to kill you. And then there was this huge, horrible, like fear mongering thing with hormones for the next 2 decades.
Whoa, hold on. So, but when you go to medical school, don't you like study hormones? Like you spend a lot of time on that topic?
No, actually, I think I saw a study that said the typical time that doctors in med school actually talk about hormones and learn about them, I think equates to like 2 or 3 days total. Now, that's not to say like for women that they don't study the
That's
female
crazy.
cycle and things like that more in depth, but as far as like hormones and hormone replacement, it really, there's a lot of talk about how much we're using it in society and how little focus is actually given to the study of it during not just med school, but like nurse practitioner school. I can tell you I had one module on it, and it was more so on menopause than it was on hormone replacement therapy.
So, like 8 years, and you only spend like 3 days on
Something
it.
like that. I mean, I can't quote every
Okay.
medical school, right? But just like anything, you can't teach everything in that med school. So it is the provider's obligation, if they're going to treat patients for hormone therapy, that they should do extra learning and take extra courses, read up on it, stay current, that kind of thing.
Well, that's probably why a lot of providers don't really want to do hormones,
Yeah, I
right?
mean, I think especially a lot of like the primary care providers, they just are so busy treating the other like disease processes, hypertension, diabetes, all the other things that are rampant in society that they just don't spend a lot of time learning and keeping up to date. Not that there's anything wrong with that, but kind of goes back to what we were talking about yesterday, all the normal labs, right? It's not necessarily normal. I think it's harder to know how to optimize hormones than know how to read a lab value, whether it's high or low or normal,
Okay.
abnormal.
All right. So you're saying it doesn't cause cancer?
I mean, not it's not a clear, definite no or yes, right? Testosterone actually in women, there's studies and research that support that testosterone is actually breast protective. In fact, it protects you against breast cancer.
Wait, testosterone in women? That doesn't make sense.
Yes,
Like
women produce testosterone.
I thought they did estrogen.
We produce that as well, and progesterone. Lots of hormones in the body.
Okay.
Lots of hormones in the
I
body.
guess that's why you're the. That's why you do this and I don't. Okay, that's fair. That's fair.
Yeah, so there's a lot of things. I mean, there are a few other, risk factors. If you have a family history of breast cancer that is estrogen receptive, we're not going to give you estrogen. We would only increase that risk, for you. But those are all things that we check for. Those are all things that we monitor and ask about and things like that. But overall, hormones are safe, especially when prescribed and managed safely. Um, and they can
Okay.
really change your life in a good way. It used to be that women, we didn't live to be 80. And so when our hormones started fading down at 40 and 50, we didn't live another 40 years to be miserable. And so it's a very understudied thing. I
Miserable.
know it's terrible, but we're miserable. When we hit our 40s and 50s and we go through these perimenopausal symptoms and like that low hormone base, it's awful. People can be miserable. They can be moody. They can be tired. They can suffer hot flashes. They can wake up in a full drenched night sweat. They can have brain fog, is one of the biggest ones I hear about. I mean, it's awful to just feel like you just get dumb because you turned 45 or whatever it is. It's a terrible thing to go through, and it's so easily treated and addressed in clinic. So easily.
Okay. All right. Well, I'll go and let them know on Facebook that it doesn't cause cancer.
I mean, maybe not. Maybe those aren't the kind of people to argue with. Maybe we just focus on educating our patients.
All right, that's fair.
Yeah.
Promise. Mostly. Okay, thanks.